The biomanufacturing plants. As I told you last time, most new plants cost upwards to $1 billion to build, take 5 to 6 years before they're even selling product, and building a plant, just about everything in it is stainless steel. Upwards to 20 miles of stainless piping. Reactors too, of course, are stainless steel. And something you probably didn't know is that upwards to 1/3 of the workforce has PhDs. They must have them in order to run these things. 1/3 of the workforce, PhDs. Another thing is they use upwards to 1 million gallons of purified water a day. 1 million a day. Wages for those workers, since so many of them are PhDs, are 50% higher than in just about every other plant. And they also have to build massive water and air treatment facilities. These plants, everything about them is expensive. Now, I'll show you some charts. Here's an article as of November 2007, Water Woes. Here you can see where it says highlighted, even in Devon's, the regional savior when it comes to business growth, is facing similar concerns. Their pharmaceutical giant Bristol-Myers Squibb is constructing a massive $750 million plant, one that promises to use enormous amounts of purified water as part of its production. And if you look down a little further, you can see where BMS promises to use 1.2 million gallons a day. So it's these biomanufacturing plants use a lot of water. Okay, speaking of water woes, here's another aspect of water woes, actually, outflow of it. If you can read that, even after this is in India, that they make upwards to $1 billion worth of medications for the United States. Even after days in a water treatment plant, effluents discharged into streams of rivers in one Indian region show concentrations of antibiotics and other drugs at 100 to 30,000 times the level considered safe. And if you scan down here, you'll see that the antibiotic Cipro is flowed out of the plant at a rate of 100 pounds active ingredient per day. And as you can see, India's share of the U.S. market in 2006 was $800 million, probably well over $1 billion by now at the rate biologics have been progressing. And if you read this section, Swedish researchers calculate that the quantities of pharmaceuticals they detected being released from the Pantencheru treatment facility in a single 24-hour period could be collected and sold in Sweden. They would fetch an amount approaching 200,000 a day, even in generic form. But as they wrote, because the production costs are so much lower than the eventual retail price, it's cheaper for companies to waste the drugs than to invest in pollution control. Well, 200,000 a day, 5 days a week, that's $1 million a week, 52 million a year that they're just wasting. And who knows what it's doing to that water and where it ends up, maybe eventually in drinking water. So that's another part of water woes. Here's an article from the spring of 2006 on wastewater that they also have to, the site requires 1.3 million of clean city water per day. So if they use it, they have to send it out clean, so they have a water treatment plant. You also see a little picture of what it's like to work in a biomanufacturing plant. It's all clean room environment, means everybody has to be all suited up to work in there. Here you see the wastewater treatment reconfigurations, and you can see the storage tanks. The wastewater treatment facility at Bristol-Myers Squibb in East Syracuse has been treating as much as 1.2 million gallons of wastewater every day for years. Okay, here hopefully you can read that. Wyeth is currently constructing what it claims will be the world's largest biopharmaceutical facility in Ireland. The $2 billion Wyeth Biotech campus on a 90-acre site in Grange Castle Business Park in South Dublin. To date, 1,100 people have been recruited for the facility. Hopefully you can read that. And if we go down further, the average annual wage of a bioscience worker in the United States, and this is as of 2004, was almost $66,000, which is $26,000 more than the average private sector annual wage. So it's very expensive to hire people because they have PhDs. Part 7, Segment 1. Watch Segment 2. Too long to put all on one segment. Bye.